we have with us on the broadcast Dr. Monica Gandhi, Professor of Medicine, UCSF Associate Chief Division of HIV, Infectious Diseases and Global Medicine, who's joining us from the US. Thanks very much, Dr. Gandhi, for speaking with us. You know, Omicron cases are rising globally. At this point, what more do we know about Omicron?
Yes. So, Omicron now has been described for exactly 2 weeks. So we only have 2 weeks worth of data. But I will tell you that there's clear patterns emerging. It looks like the Omicron variant is likely more transmissible. It took over 3/4 of the genomes in South Africa since its original description. However, it does seem to cause more mild disease. And that's now later, it keeps on being a very persistent finding, and it's both among the unvaccinated and among the vaccinated. And then finally, does it evade the vaccines? There's no evidence of that. It may be that you can get more mild reinfections with the Omicron variant, but severe disease is being protected by the vaccines.
Right. You know, there's been a steep rise in cases in South Africa, clearly indicating that this variant is perhaps more transmissible than Delta or any other variants that we've seen so far. Hospitalizations in South Africa are also rising. Will this burden the healthcare system?
It remains to be seen in terms of if the increase in transmissibility is offset by the more mild infections by Omicron. So there is in no way is the Omicron hospitalizations mirror the same pattern as we saw with Delta hospitalizations anywhere in the world, including India and in South Africa. So you're right that more transmissible variants can cause an impact on the public health system, but it really depends on now the immunity in the population in December 2021, as opposed to when, for example, Delta was first detected in India at the beginning of March. So we're in a very different place in the pandemic.
Right. Dr. Gandhi, speaking of immunity, will natural or vaccine-induced immunity guarantee us protection? What more do we know about this?
So it doesn't look like it guarantees protection in terms of just mild symptoms. Why is that? Because there's 32 mutations along the spike protein, and what are called your antibodies that you get from a vaccine or from natural infection don't work as well. Antibodies are our main defense in the upper respiratory tract, nose and mouth. And so there have been described across the world more mild infections if you're vaccinated or if you've had prior infections. However, T-cell immunity, which is a deeper immunity, it protects us in the lungs, and also B-cell immunity, which makes more antibodies, seems to be preserved against the Omicron variant so that we are not seeing severe disease in anyone who's vaccinated. This is actually now reported across the European cases of Omicron by the European equivalent of the CDC and the US CDC, that if you're vaccinated, we don't see any evidence that there's breakthroughs with severe disease. So the protection will be there, but more against severe disease.
Well, speaking of vaccinations, in the United States now a decision has been made to give booster shots to even 16 and 17-year-olds. But there are conflicting views as far as booster doses are concerned. Some countries are encouraging it, some countries still hesitant. Where do we stand?
You know, you're right that the U.S. has wanted booster doses for everyone, including now they even authorized it down to the age of 16. There isn't actually evidence yet that we need boosters for everybody for the Omicron variant. In fact, the data is quite clear that boosters are important for older individuals, like the WHO has stipulated after, for example, some of the vaccines that we give out. Also, boosters are important for immunocompromised, those with medical conditions, or those around immunocompromised individuals. But these movement to give boosters to everybody based on what's called laboratory data, just laboratory in a dish, what's going on with antibodies as opposed to real world data and how well the vaccines are protecting against severe disease, is actually not consistent. And I don't believe that everyone needs a booster just because of the Omicron variant.
Right. Speaking of, what we're seeing on our screens right now, which is a sort of map of the global spread of COVID, Europe has more cases than South Africa. UK, Denmark have more cases than South Africa. How are you looking at the pattern of spread?
So the pattern of spread has been important and interesting to observe because actually there are likely cases that were in Denmark prior to South Africa. And you can see, of course, this in the Netherlands, and you can see this pattern of travel bans, unfortunately, only against sub-Saharan African countries by the UK and the US, even though this is now found in more than 50 countries around the world. The pattern has shown that it does seem to be more transmissible. It is leading to increased cases, but very luckily, in the places that it's leading to increased cases, we are not seeing the same rise in hospitalizations, not even nearly as we saw with Delta. And so I think there are two possible explanations for this. One is that the variant may have actually emerged to become less virulent, to become more mild. This is something that can happen with time with viruses. The second possibility is we have enough immunity in the population, either through vaccination or through natural exposure to COVID-19, this long into the pandemic, almost 24 months, that we are seeing that mildness with the Omicron variant. Those two hypotheses were invoked for the ending of the 1918 influenza pandemic. Either the influenza virus became less virulent or we got enough immunity in the population, and we don't know yet what's happening.